Hello, my name is Brad Holland, President and CEO of Hendrick Health System. Today's July 28th. Today I thought I'd give you a brief update on community and hospitalizations associated with COVID-19. Since my last update on July 15th, we have seen a radical reduction in the exponential rise of hospitalizations associated with COVID-19. In fact, we've actually seen a stabilization. This is a direct but lagging result of mitigation activities in the community, specifically the governor's mask mandate, the community's compliance with that mask mandate, closing of gathering locations, and the reductions of mass gatherings in outside venues. I would like to thank each of you for helping to play your part in reductions of hospitalizations and actually a flattening of the hospitalization curve. I'd like to thank our city and county leadership who's worked closely with the hospital to spread the word of this rapid increase of hospitalizations, specifically in the public health alert, bringing attention to this spike. And I know that has been a difficult notification because it might have frightened many of you. But on behalf of the hospital and the employees, we are very supportive of our city's leadership use of this emergency alert. Here at Hendrick, we pride ourselves on a culture of excellence in working towards achieving our mission, which is providing compassion and excellent care in the healing ministry of Jesus Christ. I'm most proud of our caregivers who have worked tirelessly to treat COVID-19 patients since March. They're tired, but they have never given up. I am, however, ecstatic to report two recent awards that our caregivers and employees at Hendrick Health System have recently won. The first is Modern Healthcare's One of the Best Places to Work Award, as well as Gallup's Exceptional Workplace Award. This is the 14th straight year that Hendrick has won this Gallup Award, making Hendrick the only healthcare institution in the world to have received this award 14 straight years. And this is the second year in a row that Hendrick employees have been recognized as one of the best places to work by Modern Healthcare. This is a direct reflection of their commitment to you, our community, to treat you and keep you healthy and safe. I'd like to spend a little bit of time today talking about current statistics, share a few graphs, discuss how we work with the Abilene-Taylor County Public Health District, their new template for reporting COVID-19, as well as introduce Dr. Rob Wiley, our Chief Medical Officer and local pediatrician here in Abilene. First of all, from a statistics-wise, I'm happy to report that between Abilene Regional and Hendrick, our employees that are out due to positive COVID results or quarantines have reduced from 50 down to less than 20 today. This allows our caregivers to be available to treat you and your loved ones if you get COVID. As of July 27th, the Abilene-Taylor County Public Health District reported 463 molecular PCR active cases, as well as 471 antigen active cases. Cumulatively, that's 934 active cases. We know from a community-wide view that 5% of 934 require hospitalization. And of that 5%, 20% will end up in the ICU. We use those projections to determine if hospitalizations will continue to rise or decrease. And last of all, we're looking at percent positive lab testing. The governor has quoted that he likes to see less than 10% of the lab tests being positive for COVID-19. So I'd like to thank you again, community, for the efforts that you're doing, because it is making a difference. We do believe that schools are going to go back around August 20th, but we also still project approximately 30 patients that are COVID-19 positive to be in the hospital at that given time. On the graph on the screen, we also put a disclaimer because no one, in my opinion, knows exactly what happens when kids go back to school. But most recently, the CDC came out with a recommendation that they too believe that kids should go back to school for the health and well-being of kids, parents, and the community. With that being said, I'd like to turn it over to Dr. Rob Wiley to make a few opening comments about the school and asked him to address a few clinical questions that he gets routinely in the community. Dr. Wiley, thank you for joining us, and would just like to give our viewers a brief update.
Thank you. Well, a couple of topics I'd love to talk about. First, let's talk about the schools. And we've been meeting our medical staff, including Dr. Lowry, myself, Dr. Dratchenberg, who is the Taylor County Health Department Medical Director. We recently met with both the superintendents from AISD, who is Dr. Young, and also with Joey Lai from Wiley. And the plan is that we're going to open our schools. And both the American Academy of Pediatrics and the CDC are very clear that it is important for our schools to open up, and it is important for our students to be back. We know that the best learning occurs there. You also have to know that our schools provide much more than just an academic environment. For many kids in our community, it provides meals and nutrition. It provides health coverage for them. It provides for their rehab, whether it be physical therapy, occupational therapy, speech therapy. It provides for a safe environment. Next to a family's home, it is the safest place and the best place for our students to be. So how will the schools accomplish this? Well, we understand that this is going to be a very fluid process, that we have to be willing to change our course as needed. We will start with our students wearing masks and with our teachers wearing masks. We've already seen what masks do for our community. We have been able to level off, to flatten that curve of that exponential rise, so it does make a difference. I think both the school districts, AISD, Wiley, and including the other districts around here, have been very focused on getting our students back into class. As far as other questions that we get within our community, I think one of the most common questions that I will hear is, what is the hospital doing in regards to treatment? And how are we going about treating patients within the hospital, and what do we recommend in our community? Here at Hendrick, we have a medical committee that is chaired by Dr. Gary Binkley, who is one of our hospitalists and who is also our vice chief of staff, who chairs that committee. And that committee meets frequently to discuss the ideal treatment plan for our patients. Let me talk a little about what we do within our hospital. In our hospital, we try to stand behind what we consider a standard of care. And the standard of care for COVID-19 includes two major things. One, supportive care. Supportive care means we give oxygen, we provide IV hydration, we provide nutrition, we provide positioning for the patient. And number two, we give Decadron, which is a steroid, which has been shown to create improvement in patients who are requiring oxygen. The other thing that is a standard of care typically includes anticoagulation. And anticoagulation is the ability to prevent any forming of clots in vital organs throughout the body, and that is something that our hospital actively does. Some other treatments that are available at our hospital, but not necessarily standard of care, and you read about them frequently on Facebook and what we should and should not be doing. You hear frequently about hydrochloroquine, or what is called Plaquenil. It is available at our hospital for treatment. However, there have been many studies that have been in favor of use of it, and then there's been studies that have shown no improvement with hydrochloroquine. But we continue to do that and offer it to our patients. In addition, there have been recommendations in regards to what you would call a vitamin pack, which includes vitamin C, vitamin D, zinc, melatonin. That is another option that we provide. Again, the data does not necessarily negate the use of it or say that that's the best thing, but it is something that we offer. Remdesivir, which has been touted as the miracle drug. There's been one study that has shown some improvement. With remdesivir, the ability to obtain that medication has been limited. So we have very limited sources of that, but when it is available, we do give it. Another novel treatment plan is convalescent plasma. You've heard about this in the news. We are fortunate to be a part of a large-scale study throughout our nation that looks at the use of convalescent plasma in the treatment of COVID-19. Let's talk a little about what plasma is and what convalescent plasma is. If a patient gets COVID, they develop antibodies in their blood that helps protect against this infection. They can go to our blood bank 2 to 3 weeks after the infection. They can donate their plasma, and we can give that plasma to a patient in our hospital to help treat COVID-19. In our hospital, we've done approximately 14 to 16 of these cases. We obtained some of our plasma here in our own community, and some of it is brought in as far as New York City. So plasma has become a part of our treatment plan. The use of budesonide. This comes from a small cohort of patients who were studied by a physician in West Texas who received budesonide, and his report is that this is the silver bullet. There are no large-scale studies to support or negate what he has said. The use of budesonide within our hospital, it occurs for treatment of asthma and for respiratory diseases. At this point, we are not using it to treat COVID-19. We actually have antigen testing, molecular PCR testing, and antibody testing. Let's talk about all three of those. The molecular PCR testing is the gold standard. It is the one test that if it is positive, you definitely have COVID-19. It is 100% correct. And the negative rate, meaning that if it tests negative 97% of the time, it is going to be correct. How's this specimen obtained? Well, you've heard already, it involves a nasal swab that kind of makes you think of a brain biopsy. It's a very aggressive test to the back of the nasopharyngeal region, getting a good swab. The test in our hospital, if we run it in-house, we can have results within 2 to 4 hours. Out the outside, 12 hours. Many of these tests get sent out of our community, and that can result in a 3 to 5 day delay. It is the gold standard. The second test is the antigen test, and this is actually new to our community. It is a very effective test. It's a nasopharyngeal swab. It is very accurate, meaning that if you are positive 100% of the time, you're going to have COVID. If it's negative, there's a 10% chance that that test is wrong, that even though it says you're negative, you may still have COVID. The beauty of this test is we can get the results back in 15 to 30 minutes. And the last test that you can get is an antibody test. And that test is not a diagnostic test. It is a blood test. And it tells you if you've had the infection in the past. But it does not tell you whether you have the infection right now or not. You should know that if you do donate blood or you donate plasma, you do get a free antibody test, which will tell you if you've had the infection in the past. And that is at the Hendrick Regional Blood Center.
Thank you, Dr. Wiley. I appreciate that. One of the other questions I routinely get in the community is about vaccines and the pipeline for these vaccines. And I only know to answer the question is it's somewhere between a flu vaccine and polio eradication. Can you talk about the vaccine pipeline and what that means?
You know, as far as the vaccine goes for COVID, this is one vaccine that has moved through the system faster than any other vaccine. As a matter of fact, Moderna, which is a company, had just entered phase 3 of production of their vaccine. As of yesterday, they gave their first phase 3 vaccine, which means we've started with 30,000 volunteers to test this vaccine. And the projection is if this vaccine is effective and it creates a good antibody response, we could have a significant amount of vaccine available in 2021. The timing of that is not clear yet, but the thought process is at least 100 million vaccines by mid-2021. In addition, Pfizer is in the process of developing their own vaccine. They are not quite into the phase 3, but they are working earnestly in those areas. The question that comes to us, and especially when you talk about vaccines and herd immunity and infections in our community, the process, if you get enough people infected with COVID, then you provide protection to other people. In addition, if you get an infection, you can't get it again. Well, we're finding out that's not necessarily true. That yes, if you get COVID, you're probably more protected than others, but you're still at risk for it. And at this time, we don't know how long the antibodies last in your body. It may be 3 months, 6 months, 9 months. We don't know. I think as far as the vaccine, we are yet to see how effective it's going to be. How long will it last? Is this a vaccine we'll get every year? Will it become part of our flu vaccine? Will it be one of the types of vaccines that as we move along, we have to change it because the virus changes? So these are all great questions with vaccination. Hopeful that we'll have a vaccine available in 2021.
Well, as I routinely do say that we may be done with COVID, but COVID is not done with us. And recognizing the vaccine pipeline that you've outlined, it will be here for a little while. I request that we all do our part. If you could continue to wear a mask in public, practice frequent hand hygiene, carry a hand sanitizer with you when you go out. Don't touch your face, continue to practice your social distancing, avoid unnecessary outings, and if you feel sick, stay at home. And if you experience any symptoms of COVID-19, please get tested. If you need to get tested, please text COVID HELP, one word, COVID HELP, to 325-216-4824. We all need to do our part. I ask that each of you stay positive and test negative. Thank you.